Sayed from Drbeen.com. Welcome to one more show. So today we're going to talk about the anatomy of the autonomic nervous system. Let's start the discussion. So first of all, happy Valentine's, and let's start. So the autonomic nervous system is also called visceral nervous system, vegetative nervous system, and involuntary nervous system. The function of this nervous system, the autonomic nervous system, so let's say that is over here, with the endocrine system together, both of them together coordinate and integrate various functions of our body that are involuntary, that are happening without us thinking about them or without us consciously executing them. For example, heart rate fluctuations, blood pressure fluctuations, control over bladder, over rectum, um, respiratory systems changes, GIT systems function, suprarenal glands functions, eyes adjustment to the light, and so on. All of those things are happening by themselves and without us actively controlling them. So, who is controlling them? That is the autonomic nervous system with endocrine system. So, why am I doing this topic? One, this is important to understand the autonomic nervous system. Secondly, with the long COVID, we are seeing a lot of autonomic nervous system dysfunctions. So, it is important to understand how does this really work. So, coordinations of, for example, eye, heart, blood vessels, renal system, GIT system, bronchial system, bladder and ureters, reproductive systems, the hair on the skin, glands on the skin, and so on. Today we'll do the anatomy part of it, and then tomorrow we'll do the function, and then we'll connect it to the pathologies. So, nervous system, not the autonomic nervous system, the nervous system in our body is divided into two main systems. One is called the central nervous system. This is the brain and the spinal cord. They're together called central nervous system. The nerves that come out of them and go to the tissues, and any neurons that are sitting outside of this system are all collectively called peripheral nervous system. So think about it. From the brain, let's say there is a nerve that goes all the way to my hand to make it move. That brain itself is the part of central nervous system. The nerve that when it comes out, it becomes part of the peripheral nervous system. There are actually collections or aggregate of the neurons, that means the cell bodies of the neurons outside of the brain and spinal cord, and those collections are called ganglions. So, in technical terms, gray matter in our brain or in our nervous system, the collection of cell bodies in the central nervous system is usually called gray matter. The reason it is called gray matter is because it does not have myelin sheath on it. If we have a long electrical wire and there is a covering of white color on it, that would be called a myelin sheath. But the brain has the cells, the neuron cell bodies, they are not wrapped in that covering. And because of that, under the microscope, they look gray instead of looking white. And that is why the cell bodies are called gray matter. So a ganglion can also be called collection of gray matter outside of the central nervous system. So keep that in your mind. So first we have central nervous system, then we have peripheral nervous system. Peripheral nervous system in turn is divided into two parts, afferent and efferent. So I am trying to stress A and E, afferent and efferent. Efferent is the arm of the nervous system, peripheral nervous system, that is taking impulses or signals towards the tissues. It is going away from the nervous system, central nervous system. So imagine, let's say for the time being, let's just focus on brain. Brain is the central nervous system. When the signals are going out of the brain, then those nerves that are carrying the signal away from the brain, and I would add spinal cord, to the tissues, for example, to a muscle, those nerves will be called efferent nerves. Of course, at the same time, if you look at my skin right now, if I touch my skin, I am able to receive this sensation from it, the sense of touch from it. So of course, there are nerves here under the skin that would start from here, their nerve endings, and they would go all the way back towards the neuron, although their cell bodies are present in the central nervous system, sometimes present in some ganglions, but they are bringing the signal from the skin towards the central nervous system. These are called afferent nervous system, or this is called afferent nervous system. So I usually remember it like this: afferent, A for afferent and A for arrival. So the system that brings the nerve signal to the central nervous system, to the brain and spinal cord, those nerves are called afferent nerves. And the nerves that bring signal to the tissues and away from the central nervous system, these are called efferent nerves. Good. Now, within the efferent that is going outward, there is an autonomic nervous system and there is somatic nervous system. Somatic is when my brain sends a signal outward, so that is efferent, and it goes and moves my hand, for example, voluntarily, then that is called a somatic execution of a signal. Normally, nerves that are, excuse me, nerves that are going to the muscles are called somatic efferents. We are not concerned with that today. We are looking at efferents that are autonomic. That means these are outward going signals that are automatically controlling various visceras. And that nervous system, efferent autonomic nervous system, is divided into three parts. Enteric nervous system, that is the autonomic or involuntary control of the GIT system. So pancreas, liver, and intestine. Then there is parasympathetic system as well, which also helps with the control of the GIT, but it is controlling from outside. You'll see that enteric system, GIT itself has a complete nervous system in it, and that is enteric. Parasympathetic is a nervous system that helps with rest and digest. So when you have eaten food and you are now resting and the body is digesting that and taking the ingredients out of the food, and GIT is working and the secretions in the GIT are occurring, that all is parasympathetic. Sympathetic system, on the other hand, is also involuntary, and that is mostly related to flight and fright responses. So that is the basic division. Main nervous system, then within the nervous system, central nervous system is the brain and the spinal cord. Peripheral nervous system is everything that is going out of brain and spinal cord or connected to brain and spinal cord. That in turn is divided into afferent and efferent. Afferent is bringing impulses to the central nervous system. Efferent is taking impulses away from the central nervous system. Efferent is then somatic type, which we're not concerned with. This is the voluntary movement system. And then autonomic, which is automatic nervous system. Within the autonomic nervous system, then we have three types: enteric, sympathetic, and parasympathetic. Okay, so quick look at this diagram. So imagine this is the central nervous system. From the central nervous system, when the impulses are bringing messages to the central nervous system, then that is afferent. So for example, sensation of touch from a skin, or even from viscera, for example, heart, myocardial infarction, or angina pectoris, cardiac heart attack causes pain. That is an afferent. That is a signal coming from the heart to the body, to the central nervous system. On the other hand, the impulses that are going towards the tissues, for example, from the brain and spinal cord to the muscles, is efferent. Similarly, from the brain and spinal cord, for example, to eyes or other parts, as I discussed before, they are going to be autonomic system. So I hope that is clear. Now, quick anatomy of this system. To understand the autonomic nervous system, and this has to be one of the most important topic for medical professionals, medical students, and for all of us here as well, especially today on the Valentine's Day as well. General structure of the autonomic nervous system, the involuntary system, automatic system, is the following. It always has at least two neurons in it. Imagine one neuron is one cell that is taking impulse from point A to point B. In the autonomic nervous system, there always is an involvement of two neurons. The first neuron always originates in the central nervous system, the cell body of the neuron. Remember, neuron is at the end of the day a cell. That means it has a cell body which has a nucleus in it, and then it has those long threads. And we have done this discussion before that there is a thread that takes the impulses out of the cell body, that will be efferent, and then there are threads or dendrites that are bringing impulses to the cell body from other neurons. These will be called efferents. And of course, a cell body is a cell body. This is axon. These are dendrites. We've done this discussion before. So here there are two cell bodies at least. One neuron, and this is the second neuron here. First neuron has the cell body present in the central nervous system, either in the brainstem or in the spinal cord. We'll discuss that a little more. The general idea is the first neuron will have the axon come out of it, and that axon has to relay outside of the central nervous system on another neuron. That is a rule. Just like in the playground, you have the tag team where one person goes and tags another one, and then the other one runs. Similar thing over here, that this neuron is going to go and relay or finish, and it will finish on another neuron. And the other neuron will go to the effector. Effector is the final target of this message. Now, the second neuron has a cell body of the neuron present outside of the central nervous system. So that would be called a ganglion. So the second neuron is present in a ganglion or collection of the nerve cell bodies outside of the central nervous system will be called ganglions. Two neurons at least, one ganglion, one relay associated there. So for the autonomic nervous system, what are the things that we should know to be a master of this nervous system and to understand what is going on, and why is the heart beating fast, or why is it beating slow, or why is the blood pressure maintained or not maintained, or what's going on with the eyes, or what is happening with the GIT? To understand all of them, we have to understand some basic concepts about the nervous system. What we have to understand is, remember, autonomic nervous system is sympathetic and parasympathetic, correct? We have to understand where are the cell bodies located for sympathetic and for parasympathetic. What are the lengths of the neurons? So there is a preganglionic neuron, the neuron before the ganglion, the one that starts, the first neuron that starts in the central nervous system and ends in the ganglion. This is called preganglionic neuron before the ganglion. Then there is a neuron that starts in the ganglion and goes to the effector. This is called postganglionic neuron. So we have to understand the length of them. It is interesting that in the sympathetic system, the preganglionic neurons are shorter and postganglionic neurons are longer, generally. In the parasympathetic, the preganglionic are long and postganglionic are short. So you have to keep that in mind. Then this is very important, neurotransmitter released. So for example, you would hear this a lot, and then when you're managing the patients, you would see this as well. What kind of neurotransmitter is released from sympathetic preganglionic fiber or parasympathetic preganglionic fiber? And then what kind of neurotransmitter is released on the postganglionic fiber ending. So is it acetylcholine? Is it epinephrine? Is it norepinephrine? Is it the neurons that release acetylcholine? They are called cholinergic neurons. And the neurons that release norepinephrine, they are called adrenergic neurons. So you might hear this very commonly, that we have a cholinergic neuron or we have an adrenergic neuron. What does that mean? That is a neuron that is going to release acetylcholine or norepinephrine. So neurotransmitters are very important. Location of the ganglion. For example, in the sympathetic system, ganglions are present on the side of the vertebra. So if you visualize your body, anybody's body, and you visualize the spinal cord from inside, on the sides of the spinal cord, so that would be if you go inside the human body and go to the back wall of it, there is the vertebral column, bones. Inside the vertebral column is spinal cord. On the sides of the vertebral column are a bunch of gray matter, a chain of gray matter that is called ganglions. These are called paravertebral ganglions around the vertebra. So where is the location of the ganglion is important. And then what is the type of ramus? Ramus means arm. Ramus means arm. So what is the type of ramus? So what are the types generally? There is a white ramus and a gray ramus. White ramus, so this is a general concept to keep in mind, that when we have a nerve, so let's say this is a nerve, this is a cell body of the nerve, there are the dendrites that would receive the impulses in, then here is a neuron that would take the impulses out. If this neuron is covered with a myelin sheath with lipids, they are actually extra cells that are covering it. And those cells are stuffed with lipids. They are called myelin cells or Schwann cells, and they make myelin sheath. If the myelin sheath is present, then under the microscope, this thing would look white. And so when this collection is made in a nerve, we call it white ramus, white arm. And if there is no myelin sheath on the axon, and then there is a collection of these axons, many axons of various neurons, but they are not myelinated, under the microscope, when you see them, they would look gray. And that would be called a gray ramus. So back here, to understand the autonomic nervous system, we have to understand where are the cell bodies of the neurons. There are two. What is the length of the neuron? In sympathetic, preganglionic is short, postganglionic is long. In parasympathetic, preganglionic is long, postganglionic is short. There is a case of sympathetic where preganglionic is long as well. For example, the nerve fibers that go to suprarenal gland, they're very long preganglionic fibers. So that's an exception. What kind of neurotransmitter is being released? And then what is the location? Where is the location of the ganglion? And finally, what is the ramus? These are the things that we should keep in our mind. And just give me 1 second. I want to make sure that everybody is here. Absolutely. So Delilah says white matter and gray matter. Yes. So white matter is a collection of nerves axons, you can say cables, that are wrapped with a covering which is white in color. Gray matter is usually collection of neuron cell bodies. Brains of the neuron themselves collectively are not wrapped in a sheath. And that is why they're called gray matter, because when you see them under the microscope, they look gray. However, now this is the delicate point here. If we have a collection of axons, that is the cable, but they are not myelinated, then under the microscope, they will also look gray. Okay, so continuing, there is some something going on with the gland discussion. Now, general concept. This is the most important key for the autonomic nervous system forever. So let's look at it. Number one, we know that autonomic nervous system is divided into two parts. One is sympathetic and the other one is parasympathetic. So I'm going to look at sympathetic first. Sympathetic nervous system sends out the nerves from thoracic first segment. We call it thoracolumbar system. Thoracolumbar system. Thoracic nerves. Imagine when I'm moving my hand on my body, it is inside the body on the back wall. So thoracic nerves and then lumbar, thoracolumbar. So usually the outflow starts at T1 and all the way to L1, L2. That is a thoracolumbar part. Parasympathetic system is divided into two parts. Crânio means in the head area, it is especially in the brainstem. Craniosacrum. Sacrum is the last tail of the spinal cord. So head and tail. From there, the nerves that come out for autonomic nervous system, they are usually parasympathetic. In between the two, from thoracic to lumbar, the nerves that come out are usually sympathetic. So craniosacral, parasympathetic. Thoracolumbar, sympathetic. Now, another important delicate point that we should never forget, that is parasympathetic craniosacral, the cranial part, the one that comes out of the brainstem, the nerves that come out of brainstem. These fibers of parasympathetic system, automatic system, come out with the nerve number 3, cranial nerve. We have 12 cranial nerves, correct? Cranial nerve number 3, number 7, number 9, and number 10. You may have heard number 10 many, many times. That is vagus nerve. So we have oculomotor, facial, glossopharyngeal, and vagus. We have 4 nerves through which the fibers come out. Now please see this. Focus here. Craniosacral part, parasympathetic. Parasympathetic has the first order neuron or the first neuron that is long. So for example, the neuron would come out of the brain stem and then go almost all the way to the end organ and then make a ganglion or go near that and in a ganglion. So usually preganglionic fibers are long and they are myelinated. So they are white, they are long, and they release all preganglionic fiber. Just remember this, all preganglionic fiber of autonomic nervous system, regardless of their type, sympathetic or parasympathetic, they all release acetylcholine. They're all cholinergic. That's just a simple rule. That means if we administer acetylcholine, it would increase sympathetic and parasympathetic systems outflow. All of them will be stimulated. If we block acetylcholine, it would block both sympathetic and parasympathetic system. That is why we do not use it, because it generally blocks everything or stimulates everything depending upon what you're doing with it. Now, the second neuron of the parasympathetic system is usually short, and usually that also releases acetylcholine on its end. There are some exceptions. So that means you can just remember this, that parasympathetic nervous system is all cholinergic. Preganglionic fiber releases acetylcholine. Postganglionic fiber releases acetylcholine. Now, if I go to the sympathetic part, sympathetic fibers generally have this behavior. Imagine, look at my neck. Imagine a fiber. Let me go to my picture for a second. Imagine on the back of my neck here, the fibers are coming out, and then on the side of the neck, on the back, there are ganglions. The fiber comes out of the spinal cord and enters the ganglion and finishes there most of the time. So it's a short fiber. Came out, finished there. Then the second fiber from there would go all the way to the visceras. It would go to heart or GIT or bladder or wherever. So the second one is long. The first one is short. So here, if you see here, this is sympathetic nervous system. The fiber, the preganglionic fiber, the first fiber is shorter. The second fiber is usually longer. Again, there is an example of the first fiber going all the way to suprarenal gland. That's a long first fiber. And then there is almost a very tiny microscopic second fiber. That's an exception. The other thing, first fibers, as I said before, will release acetylcholine. The second fiber are usually adrenergic. They release norepinephrine. And suprarenal gland can release norepinephrine and epinephrine. And the medulla of the suprarenal gland, for the medical professions here and students here and nursing students here, medical students, the core of the suprarenal gland is called medulla. That is where the preganglionic sympathetic fibers go and end. Such a long fiber. Now, the medulla of the suprarenal gland doesn't have a long fiber coming out of it. These are actually neuronal cell bodies, and they were in the embryonic stage. These cell bodies were actually derived from neuronal tissue. So suprarenal gland has a pocket of tiny little brain tissue, not really brain, but nervous tissue. That is called the medulla of the suprarenal gland. It is actually made up of microscopically small neurons, which do not have a very long axon with them. They're really tiny microscopic axon. So there is the neuron, and just right next to the neuron is the axon and finishes. So it just looks like a cell. It doesn't even look like it has a branch coming out of it. It's such a small microscopic branch. So these are actually neuronal cells, and they can release epinephrine and and norepinephrine. And they do not, because their branches are very short, they just spill the epinephrine and norepinephrine directly in the blood. That's the beauty of this system. Okay, so back here, norepinephrine is usually the release at the second neuron in the sympathetic system. There are some exceptions where the second or post-ganglionic neuron of the sympathetic system might release acetylcholine as well, but that is an exception as well. So good. So if somebody asks you which system has shorter first neuron and the longer second one, you'll say sympathetic. If somebody said which system has longer first neuron and this shorter second, you'll say parasympathetic. If somebody says, well, can you give me an example of sympathetic where the first preganglionic neuron is long, you'll say, yeah, the preganglionic neurons going to the suprarenal, for example. They'll say, give me more examples. You can say this: the preganglionic fibers going to the cilia ganglion, or superior mesenteric ganglion, or inferior mesenteric ganglion, or aorticorenal ganglion. They all are long as well. But these are exceptions. Okay, so continuing. Now we look into the sympathetic system itself and then parasympathetic system itself. Cool beans, you have to become doctors with me. So here, sympathetic system, more details. Thoracolumbar, the segments that are flowing outwards are from thoraco T1 to L2 segments of the spinal cord. Now, this is the only one delicate part of this whole discussion, and then we're done. So we're really near the end. So be with me for a second. Well, today is a Valentine's as well. So check this out. Imagine we take a segment of the spinal cord, thoracolumbar. So I've taken 3 segments. Take any of them. For example, let's say you take T8, thoracic 8, and thoracic 7, and thoracic 9. 3 segments. Pick any 3 between T1 to lumbar 2. Here these are. For our discussion, let's call them T8, T9, and T10. Good. Now I'm going to look at T9. First thing that we all should know, if somebody asks you, where does a sympathetic system actually start? Where are the beginning nuclei? Are they in the brain? Answer is no. Where are they? They are in the spinal cord, and they are present. If you see the spinal cord, I've made it a little bigger. This blue thing in here, this whole butterfly like thing, this is the gray matter of the spinal cord. That means this is the central nerve cell bodies of the spinal cord. In the thoracolumbar part, the spinal cord, remember the gray matter has two rami or two parts. We say a dorsal part and a ventral part. Dorsal means the one that is on the back side, and ventral means the one that is on the front side. In the thoracolumbar spinal cord, there is an other small projection which is called intermediolateral horn. If I make that separately, think about let's say here, this is the gray matter. This is a long tube of spinal cord. This is the gray matter of the spinal cord. In the thoracic region, lumbar region, not before and not after, there is a projection of an additional set of gray matter like this. There is an extra gray matter attached on the lateral side of the spinal cord, gray matter, which is so funny, like this. Extra brain tissue. I'm calling it brain tissue. It is called just the gray matter. Extra gray matter. This extra gray matter has the nerve cell bodies of the sympathetic nervous system. This is called intermediolateral horn. Why is it called intermediolateral horn? Here is why. Look, there is a dorsal horn, posterior horn, right? There is a front horn or ventral horn. Then if something is in between them, of course it should be called intermediate horn. Why it is called lateral? Because it projects laterally. Like our ear, imagine our ear are long enough throughout our body. One ear is like going throughout the body. Then it would be called intermediate because it is sort of in the middle. The face is on the front, the hair are on the back, the ear is in the middle, and it is projecting laterally, intermediolateral. And it can go throughout the spinal cord, thoracic to lumbar. That would be called intermediolateral gray matter. The cell bodies present here are the origin of the sympathetic nervous system. This is such a beautiful thing. I love nervous system. So now be with me. I'm going to focus on this one part. Imagine there is this cell body here present in the intermediolateral horn of T9, thoracic 9 segment of the spinal cord. This neuron from here, tiny little brain cell, I shouldn't call them brain cell, I know. I'm kind of making it stick in your head that this is central nervous system. Then the axon, the branch from that fiber, comes out of the spinal cord from the ventral side, from the anterior side. And this little nerve that is coming out, the part of nerve that is coming out, will be called ventral ramus. Now is the term ramus. Ramus means a branch, an arm. You can call my arm a ramus. So here we have a ventral ramus coming out. In that ventral ramus, if somebody asks you what is in there, it is at least a motor nerve. There will be a nerve coming out of it that would go to various muscles. We don't care for that. It will have the sympathetic fibers as well, efferent fibers. That is this blue one continuing to come out. And then it goes, remember in the spinal cord, if you've read the neuroanatomy, spinal cord has two branches that are, or two nerves connected to it, one in the front and one in the back. One is called, the front one is of course called the ventral ramus, and the back one is called dorsal ramus, right? Or dorsal branch of this nerve. Then they both fuse together to make one wire. That is called a spinal nerve. The spinal nerve is the nerve that comes out of a segment of the spinal cord, and it is made up of fusion of the ventral and the dorsal ramus. The ventral ramus contains the motor nerve and the sympathetic fibers. Remember, we are talking thoracolumbar, so there is no parasympathetic fiber here. Don't ever say, well, we will have some parasympathetic fibers over here. No, we will not. We'll only have sympathetic fibers if we're talking thoracolumbar. Okay, so now let's follow that blue thingy. When it comes out, this is the efferent sympathetic fiber. When it comes out and it starts traveling in this nerve, it has to very quickly separate from it. It cannot just keep going. So it comes out of the nerve. This is all happening in the back wall of our abdominal and thoracic cavity. This all drama is happening there. So the nerve very quickly come out and separates from the spinal nerve. And it is a myelinated nerve. So when it separates it, it makes a new small arm, which is called white ramus. So the way we articulate that, the way we speak that, is we say that the efferent sympathetic travels short distance in the spinal cord and then separates from it in the white ramus. Then that nerve from there will end up in the paravertebral ganglion. Remember, we established that on the side of both sides of the vertebral column are swellings, small ganglions, collection of nerve cell bodies. So this nerve enters the paravertebral ganglion. Now what? Is it going to finish? If it finishes there, it's really going to be a very small nerve. So yes, in majority of the cases, it will finish here. When it finishes there, we will use the term relay. It would relay here. It can also decide not to relay here and continue to go up or go down. So it could actually start from segment 2, for example, T2, but then decide to go upwards without relaying or go downwards without relaying. This is the behavior of the nervous system nerve sometimes within the spinal columns, that it doesn't go. You would have read the spinal tracts as well. Spinal tracts are the nerves running within the spinal cord. And they also do this behavior of finishing in the same segment or going up and then finishing or going down and then finishing. That is a similar behavior you're seeing here. So this blue nerve, which is the efferent sympathetic, doesn't have to finish here. It can decide to go up or it can decide to go down. But let's say for our purposes, we make it finish here. So it would relay, it would finish. Done. Okay. Then, of course, it would finish on another neuron. This is a ganglion. Ganglion has neuron cell bodies in it. That is why it is a ganglion. So when it finishes on another neuron, the second neuron here in the red will give, of course, a branch as well, an axon, which would continue to take this signal forward. Now, here is the fun thing. We established that before. Preganglionic fibers are myelinated, they are white. Postganglionic fibers are not myelinated, they are gray. So when this red branch comes out of the ganglion, will it look white? No. Why? Because it does not have the myelin sheath on it. That is why this part is called gray ramus. So, how would we articulate this part? We will say the postganglionic fiber will come out of the ganglion through the gray ramus and rejoin the spinal nerve. This is like in the US at least, if you take a wrong exit, you can turn around and then go back on the same exit. This is that thing. The nerve came out and then went back. The only thing is when it came out, it relayed, finished, and a new nerve started from there which went out. But again, the signal is going to go like this. Good. Now, the second order neuron will go to whichever viscera it is working on, heart or GIT or pancreas or not suprarenal, that gets the first order, bladder, and so on. Wherever it has to go and provide control, it would go there and finish there. That is one, sympathetic. Second possibility, it is also possible that the first order neuron, the preganglionic neuron, enters the ganglion, decides not to relay there, and continue outwards and get out and go near the blood vessel or GIT or some other thing. This is that long preganglionic fiber of sympathetic system. If this happens, this little nerve that comes out of the ganglion will be called splanchnic nerve. So how many, this ganglion, the cell tower, how many things are happening to it? Ganglion is connected upwards with the other ganglion. That is one communication. It is connected downwards with the next ganglion. That is another communication. It is connected with the spinal nerve through the white ramus. That is another communication. It is connected with the spinal cord through the gray ramus. That is another communication, 4. And it can give rise to a splanchnic nerve as well, 5. Idea is simple. The fiber comes out, goes in the ganglion, relays there, second order goes out. That's one possibility. Other possibilities, fiber comes in, the ganglion does not relay, goes up. Or fiber comes in the ganglion, does not relay, goes down. Or fiber comes in the ganglion, does not relay, goes out through the splanchnic nerve to GIT and so on. Done. One of the most complex topics, which sometimes really bothers medical students or folks who are studying it. It's actually a very cute concept. Now, in this spinal nerve, 8% of the fibers are usually sympathetic fibers. Okay. So now the question is, what do these sympathetic fibers do? What are they going to cause? So check this out. They will go to eye and they would control the reactions of the eye and the focusing of the eye and so on. They will help with that. For example, think about it. And we'll do the functions of the autonomic nervous system tomorrow, but just think about it for a second. Imagine you have a lion running after you. Would you like to sit down and look at some beautiful flower there? No, the lion is going to eat you up. Instead, you would like your eyes to focus for far vision so you can see clearly and just run. So that adjustment that is needed during flight and fright, or fight, flight, and fright, that is the adjustment that sympathetic system has to do. So it does work on the heart. You can actually think about it that a lion is running after you, and think about what happens to your body. Eyes will get focused with a far vision. Heart would become fast. It's pumping, it's beating. Today is Valentine. Some people's heart are just beating without the lion as well. Bronchi, they would move as well. They would let you breathe better, so they would dilate, relax. Then if you see here, for the GIT, if I can make it a little bigger, for the GIT, the fibers from sympathetic can go through celiac ganglion. Remember celiac ganglion, supramesenteric ganglion, inframesenteric ganglion, aortico-renal ganglion. These are all examples of sympathetic ganglion sitting far off than paravertebral ganglions. So, celiac ganglion, the second order neurons or the postganglionic neurons will be going to the stomach, liver, pancreas. Superior mesenteric ganglion, the fibers will be going to the part of the duodenum and ileum and ascending colon, transverse colon. Stop there. Aortico-renal ganglion, the fiber, sympathetic fiber from there will go to suprarenal gland for go to the kidney and so on. Inferior mesenteric ganglion, fiber from that will go to the remaining part of colon and the anal canal. They would go to the bladder. So I found out today that the most difficult thing for me to draw is bladder. This is my depiction of bladder. So the detrusor muscle in the bladder, that is going to help with contraction of the bladder to create that urgency of urinating. Then trigone of the bladder, which can be relaxed to close the ureters or pulled to open the ureters, right? So these systems are under control of the sympathetic system as well. So the inferior mesenteric ganglion is a sympathetic ganglion that supplies this area. Then hypogastric plexus, they would supply the genitalia. So female genitalia and male genitalia. So again, please remember that sympathetic system, I'll do the function tomorrow, but from head to toe, it has to prepare us for fight, flight, and fright. It has to prepare us to run away from the lion. We cannot afford to sit down and start digesting the food when the lion is behind us. Lion is behind us. We cannot sit down and admire a flower. We cannot do non-fright, flight type things. So the sympathetic system will prepare us. Now, parasympathetic system, opposite of the sympathetic. It is the rest and digest system. This is the system that wants you to just relax and chill out and let your body, whatever you have eaten, let your body digest that and then convert that into energy and then store that for you. It is preparing you for the fight and flight, but not by directly making you run, but pulling the food nutrients and storing them. So this one is divided into two pieces, cranial part and sacral part, beginning and the end. That is why it is called craniosacral. In the cranial side, the nerve, cranial nerve number 3, 7, 9, and 10. These nerves are related to parasympathetic outflows. And what happens, for example, from 3, cranial nerve number 3, there is an otic ganglion. And from there, the control for the eye muscles and the movement of the eye and the focusing or the lens size, that happens. Then there is this pterygopalatine ganglion. Parasympathetic relay occurs in this ganglion. And from there, so this is the 7th nerve. It relays in the pterygopalatine ganglion, another ganglion in the head and neck area. And from there, the fibers go to lacrimal glands that make us cry or that create tears, and similarly nasal glands, which also help with the secretions in the nasal area. Then submandibular glands, so the glands here, and parotid, that is here, somewhere over here. The supply, parasympathetic supply to those glands is coming in as well through the otic ganglion and I think I wrote it incorrectly, and the pterygopalatine. Then, of course, the parasympathetic system is going to control the heart, GIT, same with bladder and genitalia. There is usually a balance of the um, sympathetic and parasympathetic to create a final tone of our system. For example, a normal heartbeat of 82, if you actually remove all the parasympathetic system, our heart naturally goes to 120. So our resting rhythm is 120 beats per minute. It is the parasympathetic system that dominates at resting state and keeps the heart slow to 70, 80, and so on. There always is a balance. At every moment, our sympathetic and parasympathetic both are discharging and they're keeping a balance. As soon as that balance becomes disrupted, we start feeling the symptoms. What kind of symptoms can we feel? So let me see if there is anything else here. Otherwise, I'll just give you some examples and then we'll look at the functions and pathologies afterwards. So, as I had said before, the long COVID discussions are probably going to be the most important discussions for the rest of our many, many months and probably lives, because there are going to be lots of long COVID outcomes. So, the um, examples of sympathetic, parasympathetic systems, for example, GIT. When you have eaten food, your GIT starts moving faster. It starts secreting more things because it wants to break down the food, put enzymes on it, break it down into smaller nutrients, and then absorb them. Plus, it wants to move the food along so that it can paste that food on its surface area and break it down. So imagine the body takes the food and kind of pastes it on a wall and then slowly digest things from it. That wall is the GIT, huge surface area. Now, if the imbalance occurs, for example, let's say the GIT movement becomes fast. If that happens, we'll start getting diarrhea. We'll get cramping. If the movement is towards the backside, retroperistalsis, then we'll start getting nausea. If the movement stops, we'll get nausea. If movement becomes reverse, we'll get nausea, even vomiting. If the secretions increase in the GIT, then we'll have watery diarrhea. And you can see that these kind of symptoms are possible with so many diseases. So it's not necessary that every disease goes and makes the sympathetic or parasympathetic system abnormal to cause these things. There can be a direct stimulation of the GIT as well to do those things. But the neurological effects that we are seeing could be because of these two. So it is important to understand the sympathetic and parasympathetic and work with them. So thank you very much for this one. It has become a long lecture. I wanted to make sure that we go over this. Tomorrow we'll talk about the functions of this system. So once again, happy Valentine's. I'll come back and let's just have a smaller time together so that you can then go and be with your loved ones. Thank you very much. If you would like to support this work, there are links in the description. There is a link for PayPal. There is another link for buying me a coffee. There's a link to become a patron. And Steve Sparks, thank you very much for your generous donation. I'll discuss that in a second. Bye bye.